In 1987, I was a hospice-trained doctor working in London, and I was invited to see people with AIDS for the very first time. And I was truly shocked by the lack of facilities for people who were sick and dying, who wanted to be at home or in a hospice. I couldn't find a single hospice in the whole of this country that was willing to open their doors to someone with HIV. And what is more, I had real difficulties persuading my own National Health Service hospice-style team to look after people with AIDS, so we had to create a new NHS team specially for AIDS, and it was also clear to me that we needed more than that. So ACET was started as a church-based response to HIV, encouraging Christians from different denominations to get involved and provide practical, unconditional, loving care and support to all who needed it at home who are affected by AIDS in any way, whether they have HIV in their own bodies or whether they are watching someone else or looking after someone else. And then, of course, there were those left behind. And we also wanted to prevent the spread of HIV, which meant going into schools, working with youth and other groups that may have lifestyles that were putting them at risk. Now, this work spread rapidly. We were soon caring for 250 people in London alone, significant teams in Glasgow, Dundee, Edinburgh, and working into many schools across the whole country. And then teams started in Romania, in Thailand, in Russia, in Czech Republic, Slovakia, and so on. And then the work has just mushroomed. And all of these teams are independent in these different countries. They have their own governing bodies. They manage their own affairs. In Zimbabwe, we are currently feeding and supporting around 2,000 children who are AIDS orphans. These people are struggling to survive in a country where the inflation rate isn't 10 or 12%. It's over 2 trillion %. Yes, 2 trillion %, which means that day-to-day survival is a huge challenge. We're supporting around 4,500 men and women at home in Zimbabwean rural villages. We're caring for around 2,700 villages from some of the poorest communities in India around Hyderabad. We're looking after orphans, widows and vulnerable children in Kigum, in the northern part of Uganda, in refugee camps. In Congo, we're working right in the very heart of Goma. In fact, our team is surrounded by militia, creating tremendous instability with 250,000 refugees on the move, and with rape being used widely as a weapon of terrorization and warfare against a completely vulnerable community. So these are challenges for us. And HIV is often more complex than just teaching people about a virus. It's about tackling really complicated issues of development, of security. These teams are from churches of different denominations, from just about every background you can imagine, and from every ethnic group. And what they're seeking to do is to just do what they can, to do what a good neighbour or a good friend or perhaps a loving family member would be able to do to someone who's in need. And at the same time, to take every opportunity to warn people about the virus and to explain to people how they can best protect themselves. Because together, I believe that the AIDS problem can be solved. We know how to stop the spread of HIV, so that people with HIV are integrated and accepted as a key part of every society, in every country, in every community, in every church, in every institution. The other good news is that infection rates have fallen dramatically in places like Uganda, where all the societies have worked together. It's government, churches, media, radio, TV, village heads, tribal chiefs and so on. Everyone working together to do what they can to make sure that HIV can be history tomorrow.